Yeah, we are live now. Good
Okay.
evening, friends. Once again, we are in front of you, and today we would be discuss हम हर बार बात करते हैं कि हम अलग अलग चीज़ों पे आप सभी के समक्ष आएंगे और बार बार आप सभी को जागरूक करेंगे। उसी संदर्भ में आज इन्हीं सभी विषयों पे आपसे बात करने के लिए हम फिर आप सभी के सामने हैं। तो आज हम जिस टॉपिक पे बात करना चाह रहे हैं और जिस टॉपिक पे बात करने वाले हैं, वो टॉपिक है हमारा कि किस तरह से जो मेंस्ट्रुअल पेन होता है, मेंस्ट्रुएशन में फीमेल्स को पेन होता है जनरली। हम ये समझते हैं या फीमेल्स ये समझते हैं कि मेंस्ट्रुएशन के टाइम पे जो पेन होता है ये बहुत नॉर्मल है या सभी को होता है, ये कोई बीमारी नहीं है। तो ऐसी बहुत सारी चीज़ें हैं जिसके बारे में हम ये समझते हैं, बट मैं यहाँ पे आप सभी को ये बताना चाहूँगा कि ऐसा नहीं होता। अगर मेंस्ट्रुएशन के टाइम पे आपको पेन हो रहा है तो वो एक नॉर्मल प्रोसेस नहीं है। मेंस्ट्रुएशन के टाइम पे पेन होना एक डिसीज की तरफ इंडिकेट करता है, एक प्रॉब्लम की तरफ इंडिकेट करता है, और जिसको एड्रेस करना बहुत ज़रूरी है, जिसके बारे में जानकारी होना बहुत ज़रूरी है। क्योंकि अगर हमारे को सही जानकारी होगी तो हम उसका सही उपचार भी कर सकते हैं, लेकिन अगर किसी विषय में जानकारी ही नहीं होगी तो उसका उपचार भी नहीं हो सकता। बहुत सारी महिलाएं, बहुत सारी बहनें, माताएं ये समझती हैं कि जब भी महीना आता है, माहवारी होती है, उस समय पे दर्द होना, पैरों में दर्द होना, कमर में दर्द होना, पिंडलियों में दर्द होना, या फिर महीने के समय पे जो गर्भाशय का दर्द होता है, एक पेट के अंदर दर्द होता है, खिंचाव की तरह दर्द होता है, ये दर्द नॉर्मल है। तो लेकिन इस दर्द के होने के कई कारण हो सकते हैं और ये दर्द नॉर्मल नहीं होता। ये भी बिल्कुल आवश्यक है जानना कि ये दर्द पूरी तरह से ख़त्म करा जा सकता है, सही से अगर समय रहते इसका उपचार किया जाए तो ये दर्द पूरी तरह से ख़त्म हो जाता है। नमस्कार, मेरा नाम है डॉक्टर प्रशांत जैन, या आप वैद्य प्रशांत जैन भी कह सकते हैं, और मैं संस्थापक हूँ निर्मल आयुर्वेद और आयु फर्टिलिटी का। निर्मल आयुर्वेद के जरिए हम जन सामान्य को जागरूक करते हैं और उनका आयुर्वेद पद्धति द्वारा पूर्णतः चिकित्सा करने का प्रयास करते हैं। इसी तरह आयु फर्टिलिटी के द्वारा हम एक जन सामान्य को जागरूक करने के लिए प्रयासरत हैं कि हम आप सभी को एक अवेयरनेस क्रिएट करें, आप सभी को ये बताएं कि किस तरह से आप समय रहते अगर अपने फर्टिलिटी रिलेटेड या फर्टिलिटी संबंधित कोई भी आपकी परेशानी है, अगर उसका समय रहते आप उपचार करवाते हैं तो बहुत जल्द ही आप हेल्दी हो सकते हैं और इनफर्टिलिटी की या वंध्यत्व की दिक्कत नहीं आती। तो इन्हीं छोटे छोटे विषय हैं। हमारी जो प्रौढ़ अवस्था है, फर्टिलिटी की जो एज है, वो शुरू हो जाती है 13 वर्ष की आयु से और वो रहती है लंबे समय तक। तो अगर इस समय के दौरान कोई भी समस्या आती है तो हम शुरुआती दिनों में ही उन्हें अगर सही रहते वक्त रहते उपचार कर लेते हैं तो वो सारी ही दिक्कतें खत्म हो जाती हैं। और अगर इन्हीं सब समस्याओं का समय रहते उपचार ना किया जाए तो इसकी वजह से फर्टिलिटी रिलेटेड इश्यूज आने शुरू होते हैं और अल्टीमेटली जिसकी वजह से इनफर्टिलिटी हो जाती है। ऐसे ही विभिन्न अलग अलग टॉपिक्स पर, अलग अलग चीज़ों पर हम नित्य डील कोशिश करेंगे कि हर हफ्ता आप सभी के सामने आए। So we will try our level best to be in front of you every week evening Saturday at 4 p.m. शनिवार, हर शनिवार शाम को 4 बजे हम यहाँ पे आपके समक्ष आए और आप सभी को इन सभी विषयों में जानकारी दें। दोस्तों, इनफर्टिलिटी एक ऐसा विषय है जो एक टैबू भी बनता जा रहा है। रोज़मर्रा डेली हमारे पास पेशेंट्स आते हैं जो इनफर्टिलिटी की समस्या से जूझ रहे हैं, लेकिन दिक्कत ये है कि वो इस चीज़ को मानना नहीं चाहते, समझना नहीं चाहते कि अगर कोई भी इनफर्टिलिटी या फर्टिलिटी रिलेटेड कोई भी इशू है तो उस इशू को समय रहते ही अगर हम उसको ट्रीट कर लें, या हमें जब भी दिक्कत हुई उसी समय उसका डॉक्टर से कंसल्ट करके हम अगर उसका ट्रीटमेंट शुरू कर देते हैं तो वो वहीं पे ख़त्म हो सकता है, वहीं पे ट्रीट हो सकता है। ऐसा ज़रूरी नहीं है कि उसके लिए आपको लंबे समय तक किसी इलाज की ज़रूरत हो। इन्हीं सब बातों को हम बार बार डिस्कस करते हैं निर्मल आयुर्वेद और आयु फर्टिलिटी के इस चैनल के द्वारा। आज का हमारा टॉपिक है इसमें टिप्स टू मैनेज पीरियड पेन, कि महीने के समय पीरियड्स के टाइम पे, मेंस्ट्रुएशन के टाइम पे जो दर्द होता है, द पेन व्हाट आवर सिस्टर्स मदर्स विल फील at the time of period or menstruation. So we are addressing that topic today, and to give you detail description on that topic, we have a very known doctor from Karnataka, Dr. Pallavi KS. Dr. Pallavi has completed her graduation and post-graduation from SDM College of Ayurveda, Udupi. It's one of the reputed college of India, and which is having conducting the biggest Ayurveda hospital of world. Dr. Pallavi have completed her post-graduation, and she is having working experience of more than 8 years in the field of Ayurveda. Dr. Pallavi is treating patients of fertility and related issues along with infertility since a very long time, and she has a very good success rate in the same. She is having regular OPDs in Karnataka and very high number of satisfied patients from the treatment. Dr. Pallavi, apart from the physical ailments, she also take care of the psychological ailments of the patient very well. She is postgraduate in the field of neuropsychiatry in the field of Ayurveda. So, with her vast experience, we would very much honored to have Dr. Pallavi today at our platform, and we like to share her views with all of you, and we would like all of you to take some good tips from her so that this pain, the problem of period pain would not stay for long and it would be cured, and every individual, every female of our world, of our nation will be healthy. And our main aim is that if we are united together with each other, then the problem of this fertility and fertility related issues will get solved completely, and none of our female or a male in the entire country will have this problem of fertility or fertility related issues. So with the same aim, we are here again in front of you. We are here again live in front of you all to discuss the same, because the fertile life of a female start with the periods, and the periods start with pain. So this is the main objective, that these periods should not start with pain and it should be a healthy menstruation cycle. How we can improve this? Because if a patient is having painful periods, then definitely there is a thing, there is some difference, because of which there is some matter, there is some point, there is some diagnosis or some pathology undergoing on, because of which a patient is having continuous pain during the periods. So if we address this thing, that why a patient person is having pain during the periods, if we address it at a very early age, then definitely it can be resolved at a very early age. And if this thing will resolve, then definitely our females will be having a healthy menstruation. And if a female is having healthy menstruation, definitely she will be having a very healthy progeny. So, with this note, I would like to invite our today's speaker, Dr. Pallavi KS. Dr. Pallavi, please welcome uh, on the session, and I would like to request you to please enlighten us with your vast knowledge related to the Ayurveda and to the this particular topic of ours. Dr. Pallavi, yes, please.
Namaste. Thank you, Prashant, for giving me an opportunity for explain and enlighten the knowledge regarding that particular topic. Coming to the proper topic, as we know that in females they are facing so many problems and they have to maintain balance the society, family, and the working area, everything. So that's why the menstrual cycle is one of the thing is what are the in that particular junction we are facing physical symptoms also, psychological imbalance also. Coming to my topic proper, today's I want to discuss you some of the hints or the tips how to manage this period pain as in the manner of psychiatric or the psychological aspect. As we know that maybe in the society you may be noticed that the females maybe they are feeling you are noticing like mood swings may be present. Today she is okay, tomorrow maybe she is feeling like irritating, without any reason she may be feeling anger, or maybe she is telling like, yeah, have no interest to do any work at all, leave me alone, I want to do sit alone, no one, I don't want to speak with alone, like that statement maybe you are hearing day to day life. Why all these things fluctuating emotions happening with the girl? What is the reason behind that? Is it a cause? Is it a disease? Or what is the things happening with that girl? So, coming to my proper topic, period pain. In that particular junction, there is an physiological changes occur. Along with that, the psychological changes also occurring with that particular lady. So, period pain related to the psychological aspect that we are discussing today. So one of the psychological disorder that is a PMS, maybe you have heard like in that particular junction, you may be feeling like mood swing or the irritation like symptoms, or maybe the person is the lady having no interest to do any activity, or maybe she is feeling like irritable without any reason she feel like irritable, and it will relapse of once that bleeding has occurred, menstruation cycle is over, the symptom will relax. So today we are discussing that particular topic, that is PMS, that is premenstrual syndrome. Related to the introduction, that in the next, the introduction, before going to the particular introduction, we have to know what is this menstrual cycle or the menstruation. As we know that menstruation is a process that occur in the woman that monthly. So that is bleeding that occur in the woman monthly. In the common term, it is called as periods. And most of the girls starts with this period when they are about at the age of 12, or it can start earlier. So it's very important to talk and give a knowledge regarding the girls in the early stage regarding this menstrual cycle or the menstruation. Why it is not it's important? Because if the girl having not knowledge regarding that thing, she may be feeling discomfortness, or maybe embarrassed, or maybe she feeling like inferiority or unhygienic, like the emotional disturbance factors that may be developed in the girl's mind in the earlier stage. That's why it is very important to give an education knowledge regarding this menstrual cycle. As we know that this menstrual cycle having two phases, like a follicular phase and the luteal phase. As in the, there is initially 14 days, if you're considering this menstrual cycle is a 30-day cycle. Initially 15 days, that is follicular phase, after that ovulation occur. Next to that, the luteal phase, after it will end in next stages, that is menstrual, the bleeding will occur. When you see this picture, that is 1 to 5, that red color, it indicates like menstrual period. After that period is follicular phase, that is pink color, from 17 to 20, 28, that can be considered as a luteal phase. Coming to the next slide, that is some information regarding this today's topic. What is this premenstrual? Today we are discussing under the period menstrual bleeding. In that psychological aspect, the very important disease, the common disease, that is the general population that is facing is premenstrual syndrome. What is this premenstrual syndrome? Why it is very much important? The person have to know about this particular disease. As I said previously, the woman's having the change in the hormonal level maybe causes the psychological imbalance. Like today she is okay, tomorrow her mood may be disturbed, or maybe she feeling irritating, or maybe children's complain like my mom is up to yesterday she is okay, next started she's shouting me, she is beating me, like that. Why all these things happening with the woman? She is stressed in the working area, or she is calm in the home, but why? How she have to manage that one? What are the reason behind that one? All these things we will discuss today, and all these things subjects are covered under the disease of premenstrual syndrome. That's why it is explained like the combination of psychological, emotional, physical, and the behavioral discomfortness in the woman occur during the time of period, that is considered as a premenstrual syndrome. And it will stops all these psychological disturbance or the emotional disturbance what it is occur in that particular woman. It will stop once the bleeding has occurred. The all the symptom will start, that is before the onset of the menses, that is 1 week before the onset of the menses. And once the bleeding has occurred, that is menstrual is over, the symptom will be starts. That is considered to be the points, that is the diagnostic criteria or the regarding the disease of premenstrual syndrome. And this disease in the name itself explains like pre means before, and the menstruation means period. So before the onset of the menses, if the psychological, emotional, or the physical symptom if it is present, and after the once the menses has over, the symptom are stopped, that is considered to be premenstrual syndrome. As the menses occur in a cyclic manner, so the symptom may be occur in a cyclic way. That is, in this month, if you consider 30 days is a cycle, in that if you divide into 15 as a two phases, last second 15 days there may be luteal phase if you are consider in this last week, where maybe you can find the symptom regarding this premenstrual syndrome. So, and the same symptom may be occur in the next cycle also. That's why, so you have to evaluate by taking the history of 2 or 3 cycle. From that we can decide whether the lady having the whether the premenstrual syndrome is present or not. Regarding this, next we will discuss what is the cause for this particular disease. As I explained, mainly if something hormonal changes, that is mainly in case of the menstrual cycle, the progesterone and the estrogen hormone level, that imbalance, that maybe leads to this particular disease. As initially, as I want to explain, like there is no particular direct cause to tell the disease as PMS because of this cause, but some of the studies has done, depend on studies, some of the studies accept like there is change in the hormonal level, maybe one of the cause for the PMS, or maybe the serotonin level hormone changes. As we know that serotonin is a hormone which is responsible for the mood stabilizing. If the hormone level is decreased, the psychological symptom in related to the depression, anxiety will increase in the body. So these serotonin and these progesterone, estrogen hormonal related to each other. So imbalance in this progesterone or the estrogen hormones, or maybe imbalance in the serotonin hormone at the time of the premenstrual time, that maybe leads to this particular disease. So it can be considered as one of the cause for the disease. So mainly they are considering no cause, but generally by some of the studies explain this is the one of the cause. Coming to the next, what is the incidence? What is the incidence of this particular disease? So how many people are suffering from this particular disease? So what age, if you want to see at what age the disease is very common. As we know that this disease usually subside once the menses is over. That's why we can easily tell, like in the reproductive age group woman, in that age group the disease is very common. So from the late 20 to the age of 40, you can find this PMS disease, that is premenstrual syndrome disease, that you can find in the woman. So coming to the incidence, so about 40, by seeing some of the statistics, it is explained like about 48% of the women maybe you can find mild symptom, coming to the moderate symptom like 41%, and few amount of the person, that is only to 10%, below 10% of the persons may be suffering from the severe symptom of the PMS. If the severe symptom of the PMS, if it is present, that is called by one more other disease, that is a premenstrual dysphoric disorder. If the same symptom in the milder stage, if it is present, that is premenstrual syndrome. That's why in the generally we can see these are the things like psychological changes which are maybe present. So this is one of the disease very common. Coming to the next thing, what may be the, what is this physiological premenstrual changes? There are two variety. One is physiological premenstrual changes and one more is psychological. Physiological means all this menstruation process is going on, but the psychological symptom are totally absent. The woman can cope up with that particular, or tolerate, or can do all the activities sufficiently actively at that particular luteal phase. There is no psychological disturbance, or maybe she is not at all feeling irritation and all. That is considered to be the psychological premenstrual changes. Around 10% of the women having the absence of this psychological symptom in the premenstrual time, but maybe majority of the person, maybe you can see that is mild to moderate symptom of the premenstrual syndrome symptoms may be present. Next one. So what are the clinical findings that you can find in the person to diagnose the disease of premenstrual syndrome? So, as I explained previously, in case of the premenstrual syndrome, there may be psychological symptom may be present, or maybe the physical symptom maybe you can notice. So, what are the psychological symptom that you can find? One may be anger. Anger, like the person without any reason, the woman maybe get anger. As I told, the mom can be beat to the children without any reason. She may get irritating because of simple reason, or the mood swing may be get present, or the she can't manage the stressful condition, or the anxiousness. That is, when you ask why you are feeling so much fearful, complex, and all, there is no reason for that, but still she is telling, feeling like I am feeling uncomfortableness, like stressful situation, like anxiety, or the phobia like symptom may be present, or maybe depression, like lack of interest in the day to day activity. As that type of clinical symptom also you can notice, or the restlessness, or maybe not able to sleep. There is disturbed sleep, like initially she may be feeling difficulty in the sleeping, or maybe if she gets slept also, there is difficulty in the maintenance of the sleep. Like that symptom also you can notice. Or maybe crying without any reason, she starts crying. Or maybe if you scold in the normal talk in a louder manner, that may be causes her to make an more emotional, and she starts crying. Along with that, lack of concentration, and because along with very important thing is she start herself to isolate. That is social withdrawal symptom also you can notice. So finally, in case of the PMS, the psychological symptoms are very much predominant. So it's very important to evaluate what are the psychological symptoms present. That may be the anger, or maybe the mood irritability, or the mood swing, depression, or the restlessness, or the crying. Like that, the thing you have to check. Next, about the physical symptom. What are the physical symptom? Next, physical symptom. As it's a combination of psychological symptom along with the physical symptom. So physical symptoms like fatigue, like a headache, like there is a presence of acne, or maybe joint pain, or abdominal discomfortness, or the maybe bloating maybe you can notice, or maybe swelling, edema in the foot, or maybe cramps, breast tenderness, like that. Physiological symptom along with the psychological symptom may be present. So from that you can evaluate, like the person, or the lady, the woman may be having this premenstrual syndrome. Next, how we can diagnose this particular disease? Is it so before to that diagnosing, is it very important, like some of the disease where these symptoms are present, but we can't diagnose this disease as PMS. So they are mixed up each other. For example, in the case of thyroid disorder, mood swing may be present, or maybe lack of appetite, or the sleep disturbance, or the irritable mood. All these things are present. But in case of PMS also, these are the things are present. So the symptom are mix matching with the too many diseases. In that condition, how we have to differentiate and how we have to diagnose that condition, that's very much important. Because once we diagnose the condition correctly, then only we can treat the disease very easily. That's why diagnose the condition is very much important. So some of the disease where the similar symptom you can find in related with the PMS are, that is one may be the thyroid disorder, or maybe in case of the migraine, or maybe some of the psychological disorder, like in case of anxiety, or maybe in case of the depression, where also you can find similar symptom related to the premenstrual disorder. But how we are differentiating from these disease, as we know that the premenstrual syndrome is occurs in the before the onset of the menses, and it will subside once the menses, or the bleeding, or the menstrual cycle has occurred. So, but comparing to these four differential diagnoses, in case of the anxiety, if you want to diagnose the anxiety, the fearful complex, there is without any reason the person is feeling like anxiousness, or there is no reason at all, and there is a criteria explained, like must 6 months the symptom must be present, then only we can consider. But when in the case of the PMS, the within the 15 days of phase, once it comes and it will goes. And in case of depression also, where the lack of interest will be present and it will persist. That is, in the whole month, the lack of interest may be present, but in case of the PMS, where the last 15 days, there only you can notice the lack of interest in the activity or the negative thought. All these things are present. So, from that, you can differentiate too many disease from the PMS as it looks like PMS itself only. So, you have to differentiate. So, next one. So these are the different some of the diseases. So diagnosis of the disease is very much important, as there is no blood test which will give the result regarding the disease of PMS or any ultrasound which explain that the person or the lady or that woman having the disease of PMS. Then how we are diagnosing that one? As previously we have discussed like some of the thyroid disorder if it is present, by doing some thyroid test, function test, from that you can evaluate, or maybe as in the psychiatry it is explained like all psychiatry disease problem is hidden in that particular cause itself. Those the history is very much important. If you take on the history properly, if you diagnose the disease, then we can easily treat that particular condition. One more thing, how we can diagnose, that is menstrual diary. We have to maintain the menstrual diary for about 2 or more than 3 months. That is, in this picture maybe you can see like there is starting from 1 to 28. If you consider 28 days one cycle, you have to make a column from 1 to 28. You have to mark from first, that is 1 to 5, that is the bleeding time. After that, from 6 to 28, you have to mark your emotions, in which day you are happy, when which day you are sad, which day you are feeling irritation, which day the joint pain or the abdominal bloating symptom are present. So like that, you have to make one chart, monthly chart, that is menstrual diary or the monthly chart you have to make. Consequence of 2 or 3 months, you have to make that particular chart. After that, you have to evaluate, you have to compare the chart, one from first chart, second chart, third chart. You have to compare. It is not like in the first cycle the symptom are present, must be present on the second cycle or must be present on the third cycle. It may be differ, or maybe if the woman who having the one symptom in the maybe differ to the other woman also. So symptom may be different, or the severity may be different, or the condition may be different. The symptom like it may be different. That's why it's very important to evaluate. For that, you have to take the menstrual diary chart. From that, by seeing that, you can easily make, or we can easily diagnose by ticking like, yeah, that woman maybe is suffering from this PMS or not. Next one. So like this. So maybe you have seen emojis. So you have to make, that is sad face or maybe happy face, mood like upset or the scared, like the different things you have to use in the chart. So that from that there are now a present day some of the apps are also available to make, that is you have to mark every day. So which day you are feeling irritation, which day you are feeling hesitation, or maybe crying like feeling, lonely like feeling. When you go to the luteal phase, as there is change in the hormonal level, or maybe change in the serotonin hormone or the progesterone or the estrogen hormonal level, the mood swing is a common symptom that we can noticing. So some of the symptom may be severe, some of the person, the some of the symptom may be very mild. So it is important. These are the things by using that you can make the chart. Next one. So coming to still now we have discussed like what is that premenstrual syndrome, what is the importance in day to day life, as the woman having so many responsibility to maintain the family, as a mother, as a daughter, as a girl, she having so many relationship, she have to maintain all the relationship. Along with that, as a menstrual bleeding, the menstrual cycle is a part of life which is occurring. Along with that, psychological disturbance also you can notice. So that's why it is very important to manage that condition. Otherwise it may be end up in next consequence, may be having the negative outcome on the life. That's why it is very important to manage in the milder stage itself. So if it is, as I said, it is a 48% people are suffering from the mild stage of PMS, but they are not at all taking importance. So they are neglecting that. As we said, if once we have, as it is the like psychological symptom, if it is present means people are afraid of explaining to share that psychological disturbance feeling to the doctor, like by thinking like maybe they are feeling we have some other psychiatric disease. It's not that one. We have to share if any psychological disturb, mild psychological disturb, it's hampering to our day to day activity or the routine activity or the relationship or the social or the occupational area, that we have to discuss and we have to take solution when they are in the milder stage itself. Otherwise in the future maybe it will triggers or maybe it leads to any other complication. That's why it's very important to treat that psychological disease when they are in the milder stage itself. So coming to the mild state, what type of treatment, it is very much important. First one, lifestyle changes that we have to adapt in the case of initially, where in the form of diet or maybe in the form of exercise or maybe some stress releasing activity or maybe some of the psychotherapies that we have to adapt or maybe supportive therapy. By using that we can manage the condition, or in case of the severe condition where the medications are needed. So how, what are the lifestyle changes that we can adapt in the form of diet? So when we see the diet next, diet is very important. uh, Diet is considered to be very important. It should be simple and it should be healthy. So, using diet, if we treat a disease, it's considered to be very good, where there is no need of medication. Usually, as a normal tendency of the common mind, like taking medication, the people will not feel good. So, if we give a medication in the form of diet, it's having very good effect. So, by thinking I am taking a food in the mind, they will take. If the same thing, if you are given in the form of medication, they feel like I don't want medication. Like that mentality may be present. That's why starting as a mild PMS in that condition, we have to manage with the help of diet. So that diet should be simple, healthy, and it should be homemade. So, in as we saw, the physical symptom like abdominal bloating like symptoms are very common in the condition of PMS. So, what type of our meal should be? As the person is taking 3 meal per a day, so we have to make it small quantity, like a small frequent 2 meals, like 6 meals. We have to make it intervals. For 2 hourly, we have to make intervals so that we can reduce the quantity, so that the blotting symptom what it is occurring in that phase we can reduce that one. Or maybe diet in the form of avoid the oily products, oily vegetables and all, high carbohydrate, and avoid sugar. The whole grains should be used, and the vegetables, leafy vegetables, fruits, or the high fibrous content food should be used, so that it will help for the to reduce that abdomen bloating symptoms. Coming to the next one, we have to avoid the salt restriction is very much important. So what we are eating, what we are eating, that is like maybe very chats and all, which is having the very spicy along with the salt, pepper, all the things are added, and it is very tasty. But in case of the PMS, where the salt restriction is very much important, as there is a swelling in the edema is a predominant symptom, physical symptom that you are noticing in that particular juncture. So salt restriction, or maybe avoid the chats, avoid the pickle, and avoid adding extra salts to the dishes should be avoid. And avoid the caffeine items like coffee, tea. It will change the moods of the person. That's why it's, effect on the psychological aspect of the mind. That's why we have to avoid the caffeine or the alcohol. So that's why we have to use food in the form of low sugar, low sodium, high fiber, and the complex starch type variety of food should be used. So this is regarding the lifestyle. So next one. Other than that, supplementation of the food in the form of the very rich folic acid food or the vitamin B6 food or the vitamins D, like a high quantity vitamin D food should be used, or maybe in the form of calcium rich food. For example, calcium rich food are dietary, some of the dietary products can be used, avocado can be used, and the magnesium. Magnesium is very much important in the case the abdominal bloating symptom, or maybe or by edema in that condition. Magnesium is very much important. Magnesium mainly rich foods are, that is banana is considered to be magnesium rich food. That's why in the woman at the menstrual bleeding, that is in the pre-EMS time, before, that is 1 to 2 bananas are advised. It having the high fibrous content, it will help her to relieve the symptom. Coming to the next, what should be avoid? As I said, we have to avoid the oily foods or the oily vegetable oils, or maybe you can use the coconut oil, you can use, or the butter that we have can use, like ghee that you can use. These are the things, and the caffeine we have to avoid, and the alcohol, pickle, these are the things we have to avoid. Next, as I said, so these are the regarding exercise. Exercise are come to be very much important. So we have to do daily exercise. So in which form we have to do daily exercise, like a brisk walking, or maybe swimming, or maybe cycling, like different variety of the exercise we have to do. By doing exercise, what happens? The serotonin hormone is inducing. So the serotonin hormone is responsible for the mood stabilizing. So then the person is very happy and she can manage the particular situation. So how many times, how many hours she have to use? There may be 45 minutes. The brisk walking can, she, it is advised. And maybe when she have to start, that is in 20 to 25 days in a month, the variety of exercises are advised. So along with that, adequate sleep and rest also very much important to maintain the health condition. As we know that if the sleep is good, half of the diseases will be reduced. Like that, it is explained like some of the statistics, 20 to 25% of the diseases are occur because of the disturbance in the sleep in the present day. As we are not at all, as because of our work schedule may be one of the reason, or maybe some of the stress, work shift, any pressure, like that, our sleep is totally disturbing. Disturbed sleep is a major cause for the presently occurring major diseases. That's why we have to maintain sleep in the proper manner. It may be lifestyle disorder, maybe that is the sleep is considered to be very much important. That's why adequate sleep and the rest for about sleep for about 8 hours are very much important in the condition of PMS. So coming to the next one, what other than this, what are the things we have to do? So hobby time. So we have our own work, like we are morning we are doing our routine work, homework and all, like later we will go for the work. So in between that we are forgetting ourselves. Finding me is very much important. We have to give time to ourselves. So if we give time to ourselves, it will nourishes our mind, relax our mind, so that we have to engage ourselves which we are liking. Starting from initially when we are in the childhood, we are doing the things as a hobbies which we are feeling very much happy and all. But as when we enter to the next, like mid age, we are busy with our work and all, we are forgetting our hobbies. That's why hobbies are very much important. By doing hobbies, what happens? The positivity in the mind will increase, and the negative emotion, what it is developed in the mind, is totally decreasing. That's why improvising the hobbies, it may be hobbies, may be in the different variety. Maybe some are having feeling like a happy moment by singing, they feel relaxed mind, or maybe by playing games or speaking with who they very like, or maybe gardening. Like different hobbies may be very much important to reduce the negative emotion what it is developed in the mind. It is one of the thing. From that also we can manage the mild psychological disturbance what it is occur in the mind. Coming to the next variety, how we can manage, that is maybe in the form of yoga or the medication, or that may be like a relaxation technique. So following yoga, pranayama, from these things we can manage the stressful psychological condition or the psychological disturbance that is occurring in the mind. Next, so still now we have discussed the related to the milder stage, how we can manage. Next, if it is we can't manage the milder stage with this one, if the symptom are very severe, in that condition, what is the thing we have to do? In that condition, medications are very much important. Medications are needed. As I said previously, the severe symptom of if it is PMS is present, then it is called as premenstrual dysphoric disorder. So in this condition, severe depression symptom may be present, or maybe the leg pain symptoms may be present. In that condition, how we can manage that one? In that particular junction, there is antidepressants are very much usually prescribing, or maybe as a joint pain like symptom if it is present, the painkillers also they are prescribing, or maybe swelling symptom, that is diuretics, or maybe estrogen progesterone hormone imbalance if it is present, there may be by using a hormonal pills they can manage the condition. The very much important thing is never buy over the counter. That means still now we have discussed like what is PMS, what are the symptoms may be present in the relation with the psychological aspect in relation with the physical aspect. So now we think like we have disease, so we can directly go and ask the medication in the medical shop. It's not like that. So before asking, before diagnosing ourselves as we have some disease, it's very much important take in caution, just consult your doctor. Without consulting doctor, no, no need take the medication. So before diagnosing ourselves, it is very much important consult your doctor, then only they will prescribe what type of medication needed for that particular person. Next, so as a complication, the that is in case of the premenstrual dysphoric disorder, I have told that is suicidal tendency, like 10% of the people may be facing symptoms like suicidal tendency, or the negative symptom, negative consequence may be present. That's why it is very much important, if initially treated this condition, then it is well and good, but if it is neglected, it may be end up in some other complication. That's why we have to manage that particular condition. Other than this, the PMS can be managed by using some of the psychotherapy technique like a cognitive behavioral therapy, where modifying the negative thought into the body positive thought. Like if it is the in that particular person anxiety, if a symptom is very much predominant, in that condition, what are the different cognitive therapies can be applied in the condition of anxiety, and what is the reason for the anxiety, that we have to initially we have to check. From that we can treat the particular condition. Same in the form of depression is a predominant symptom, if it is present in case of the PMS, we have to evaluate the depression, what is the cause, and from how we can change negative thought to the positive thought with the different variety of the psychotherapy. All these things we can adapt to manage the condition of PMS. Next, so coming to the Ayurvedic aspect. So in this Ayurvedic aspect, this disease can be considered like how we can manage, depending on the symptom we can manage this particular disease. So we are by seeing there are in the Ayurvedic management there are two varieties line of treatment we are usually adapting, like giving some of the medication subsiding the symptom, that is in the form of shamanaushadhi, or maybe in the Ayurvedic term, or maybe in the term of like giving medication evaluating the, like expelling out of the toxic um, toxicity in the body, like in the form of mana virachan, like panchakarma procedure if we are adapting, that is considered to be two way of treatment that we have to adapt. By seeing this technique, there is one picture I have quoted here, that is like maybe you have saw in so many pictures in the Ayurvedic shops and clinics and all, that is pouring the medicated oil to the forehead. So, what happens in case of the PMS where the irritable mood is present, mood disturbance is present, anxiety as a symptom is present, and there is negative thoughts usually developing, and the sleep disturbance. In all these conditions, this Shirodhara, his technique is very much helpful. That's why it will calm the mind, relax the mind. There are different varieties of oils are advised, or maybe different varieties of Ayurvedic preparation in the term of oils, or maybe in terms of buttermilk, or maybe plain water also can be used for the purpose of Shirodhara. So from that we can reduce the psychological disturbance in the form of negative thought which is developed in our mind, or maybe the mood swing what it is developing in our mind. So along with that, other panchakarma techniques like that is maybe heard like abhyanga, or maybe that is the thing, or maybe shirodhara, that is over, or maybe shirobasti, like different varieties of treatments are there that we have to adapt. By doing that also the symptom that can be reduced. Coming to the management in the form of prescription. So, in the prescription, Shatavari is a drug. It is considered to be greater effect in this one in particular condition. There are so many studies also carried out which has given best effect. It will regulate the hormonal disturbance which because of the change in the hormone like progesterone and estrogen hormone disturbance what it is occur can be managed by using the shatavari as a drug. Along with that, other psychological symptom what it is there that can be managed by using some of the brain like Medhya Rasayana drugs, brain tonics like maybe Brahmi, you may be heard like Brahmi, Mandukapani, Shankapashpi, like the drugs are there. By using that, we can manage the condition. Our caution is before taking our own prescription, just consult the doctor. Then only the doctor will check you by seeing your symptom, what it is there, and whether it is that particular disease itself or not. Later he will prescribe the medication. These are the some of the Ayurvedic treatment can be using in the case of PMS. Coming to the last one, that is conclusion. So, as I coming to the conclusion of this particular disease, PMS is considered to be the very common disease that you can find in the general population, but the people are not at all noticing this particular disorder. So, it is very much important to notice and take proper management, proper guidelines regarding this particular disease. That's why awareness regarding this disease is very much important. And as it is once the person or the lady who having the psychological disturbance, it will affect in the all the way. It may be in the social manner or maybe in the family atmosphere. It will affect all the relationship. That's why it is very important. And the symptom will, when it will subside, once the that is menses has over, the bleeding is occur, the symptom is totally subside. So by treating this, the person can lead a quality of life. How we can treat that one? Initially create the awareness in the general population regarding this disease, not to treat like she having some other disease, she having other psychiatric problem. It is a common thing occurring with the every woman, but we have to given some attention or the care to that particular lady, and to make self screen technique by adapting the menstrual diary chart, or maybe some adapting the lifestyle changes in the form of diet, or maybe in the form of exercise, or maybe avoiding some of the food which increase disturb the hormonal level. Some of the exercise daily routine activity, or improvising our hobby, giving time to ourselves so that we can avoid the negative thoughts which is developing in our mind. If it is from these also it is not at all maintained, we have to consult the doctor, where they can prescribe some of the medication, or maybe some of the psychotherapy, or maybe some of the adapting yoga technique by doing yoga or the pranayama medication, so that we can improvise the condition, like the symptom may be reduced, the positive thoughts may be increase in the mind, so that we can maintain the psychological balance in the mind. Next, thank you. Thank you once again.
Uh, Thank you, Dr. Pallavi. It was a very enlightening and very important session and very important information what you have shared with all of us. And I must say that आपने अभी जो भी बताया related to the premenstrual syndrome or premenstrual dysphoric disorder. So it is very much important for all of us to know about what is premenstrual syndrome. And like we have discussed earlier in the initial, very initial, I have told you. मैं एक बार हो सकता है थोड़ा सा हिंदी में आई जस्ट कंटिन्यू विद द सेम जो स्लाइड्स हैं और जो आज हमने बात करी, एक बार थोड़ा सा ओवरव्यू इसके देने की कोशिश करता हूँ। तो हाउ ये पीरियड्स का जो पेन होता है इसको क्या कहते हैं, इज इट नॉर्मल और नॉट नॉर्मल? तो मोस्ट ऑफ द वुमेन्स, ज़्यादातर औरतों को, महिलाओं को ये लगता है कि ये पीरियड्स का जो पेन है ये एक नॉर्मल होता है, बट ये नॉर्मल पेन नहीं है। अगर आपको पीरियड्स के दौरान कोई पेन होता है, पीरियड से पहले पेन शुरू हो जाता है या पीरियड्स के दौरान भी पेन होता है, सो इट इज़ अ नॉट अ नॉर्मल प्रोसेस। अगर पेन होता है देन इट इज़ वो हम कंसिडर करते हैं प्री मेंस्ट्रुअल सिंड्रोम के अंदर या डिस्फोरिक डिसऑर्डर के अंदर, जिसके बहुत सारे सिम्टम्स भी होते हैं। और अगर ये बार बार होता है, अगर एक या एक बार हुआ है तो इट्स नॉट अ बिग डील, अगर ऐसा हो रहा है तो कोई बड़ी बात नहीं है। लेकिन अगर ये प्री मेंस्ट्रुअल सिंड्रोम जो है ये बार बार होता है, या हर बार जब भी महीना आना आता होता है, या जब भी महीना आने वाला है, जब भी पीरियड्स आने वाले हैं उससे पहले अगर ये दर्द होना शुरू होता है, तो इट्स नॉट नॉर्मल। और कई महिलाओं में ऐसा देखा गया है कि बिकॉज ये जो बार बार पेन होता है, ये हर बार पेन होना, ये कहीं न कहीं एक हार्मोनल इम्बैलेंस को हमारी बॉडी में दिखाता है कि बॉडी के अंदर कोई ना कोई हार्मोनल इम्बैलेंस, जो हमारे हार्मोन्स है, एस्ट्रोजन, टेस्टोस्टेरोन, ईस्ट्रोजन, प्रोजेस्टेरोन, ये ज़्यादा सारे जो हार्मोनल लेवल है, वो लेवल नॉर्मली नहीं है, जिस वजह से दर्द कंटिन्यूअसली बना रहता है या हर बार होता है। अब इसके बहुत सारे एस्पेक्ट्स हो सकते हैं, फिजियोलॉजिकल एस्पेक्ट भी हो सकते हैं, साइकोलॉजिकल एस्पेक्ट भी हो सकते हैं। ऐसा भी हो सकता है कि ये जो महीने के दौरान पेन है, ये आपकी बॉडी के अंदर जो हार्मोनल का इम्बैलेंस है हार्मोन्स का, उसकी वजह से हो रहा हो, या फिर ऐसा भी हो सकता है कि आपका मूड अगर स्टेबल नहीं है, उस वजह से भी हो रहा हो। ऐसा भी देखा गया है कि अगर प्रीमेंस्ट्रुअल सिंड्रोम है, तो उसमें ऑटोमेटिकली जो मूड होता है, वो स्टेबल नहीं रहता, डिस्टर्ब रहता है। आप देखोगे गुस्सा बहुत ज़्यादा आता है, इरिटेबिलिटी बहुत ज़्यादा होती है, स्ट्रेस रहता है, एंग्जाइटी रहती है। तो ये सारे लक्षण उसके अंदर रहते हैं। इसी के साथ मैं अभी यहाँ पे रिक्वेस्ट करना चाहूँगा, जो भी हमारे व्यूअर्स हैं अगर देख रहे हैं, तो अगर कोई भी उनको डाउट है, कोई कुछ पूछना चाहते हैं, क्वेश्चन पूछना चाहते हैं, तो डेफिनेटली वो पूछ सकते हैं और विल ट्राई कि आपके क्वेश्चंस का मैक्सिमम आंसर करने की कोशिश करें। फिजिकल सिम्टम्स में होता है थकान रहना, सर में दर्द होना, नॉजिएटिक सा रहना, जोड़ों में दर्द होना, हैवीनेस रहना शरीर के अंदर, टेंडरनेस रहती है, ब्रेस्ट टेंडरनेस रहती है, सारे ही फिजिकल सिम्टम्स भी होते हैं। बहुत सारे इसके कारण हो सकते हैं। जनरली थायराइड जिन महिलाओं को रहता है उनमें भी ये देखा गया है, उनको भी ये दिक्कत होती है। तो कैसे इस समस्या से समाधान कैसे पाया जाए, डॉक्टर पल्लवी ने हमें बहुत ही अच्छी तरह से बताया कि कैसे हम इस चीज़ से बच सकते हैं, कैसे हम अपने आप को बचा सकते हैं, कैसे सुधार कर सकते हैं। तो उसके लिए सबसे ज़रूरी है कि हम अपना लाइफ़स्टाइल जो है उसे मॉडिफ़ाई करें। देखिए, कभी भी कोई दिक्कत हमारे शरीर में होती है तो उसका बहुत ही एक मेजर कारण जो होता है वो लाइफ़स्टाइल डिसऑर्डर होता है। तो लाइफ़स्टाइल को यहाँ पे मैनेज करना, लाइफ़स्टाइल को मॉडरेट करना, लाइफ़स्टाइल को मॉडिफ़ाई करना एक बहुत अच्छा तरीका हो सकता है जिससे हम बहुत सारी चीज़ों को सुधार सकते हैं। अब लाइफ़स्टाइल में क्या चेंज करना चाहिए? लाइफ़स्टाइल में सबसे पहले जो चेंज करने की ज़रूरत है वो है कि आप अपना खान-पान को चेंज करें, आप अपना डेली रूटीन चेंज करें। खान-पान में ऐसा खाना खाएँ जो रिच हो, फाइबर्स में, मैग्नीशियम में रिच हो, फॉलिक एसिड, विटामिन डी, विटामिन बी6, बी12, कैल्शियम रिच फूड हो। अवॉइड करना है जो भी जंक फूड होता है, अभिसंधी आहार होता है या ऐसा खान-पान जो डीप फ्राइड हो, ज़्यादा उसमें कैलोरीज़ हों, ये सारे खान-पान को अवॉइड करना चाहिए। रेगुलर एक्सरसाइज़ करें, बॉडी को तंदुरुस्त रखें, हेल्दी रहेंगे, ब्लड का सर्कुलेशन प्रॉपर रहता है। एक्सरसाइज़ करने से हमारे हार्मोन्स का लेवल जो है वो बूस्ट अप होता है, हार्मोन्स का लेवल स्टेबलाइज़ रहता है एंड डेफिनिटली इट विल हेल्प यू आउट। नेक्स्ट बात करते हैं तो और क्या कर सकते हैं। ये एक बहुत ज़रूरी चीज़ है कि हॉबी, आप कुछ ना कुछ जो भी करते हैं, जिस भी चीज़ में आपको इंटरेस्ट है, वो अपने रेगुलर रूटीन में लेके आएँ। अपना समय खुद के लिए ज़रूर निकालें, थोड़ा-सा समय खुद को ज़रूर दें। रेगुलरली अपना समय खुद को देने से भी आपके जो हार्मोनल लेवल है वो स्टेबलाइज़ होता है, मूड अच्छा रहता है, मूड बूस्ट अप होता है और जो साइकोलॉजिकल एस्पेक्ट है वो कम होते चले जाते हैं। इसके अलावा रूटीन में योग करें, प्राणायाम करें, सूर्य नमस्कार बहुत अच्छा है। योनि मुद्रा में प्राणायाम अगर आप करते हैं, तो वो भी आपकी योनि को, आपके गर्भाशय को बल देता है, स्ट्रेंथ देता है, जिसकी वजह से ये दिक्कतें होनी कम हो जाती हैं। इसके साथ मेडिकेशंस में बहुत सारी मेडिकेशंस हैं। नॉर्मल मेडिकेशंस आप क्या-क्या ले सकते हैं जो आपको हेल्प करेंगी, वो है अगर आप रेगुलर तौर पे आपको ये बार-बार दर्द होता है, तो इस समय पे जब भी आपको दिक्कत हो रही है या प्री मेंस्ट्रुअल सिंड्रोम हो रहा है, महीने के समय पे दर्द होता है, तो आप थोड़ा-सा अजवाइन का पानी ले सकते हैं। अजवाइन का पानी बहुत अच्छा हेल्प करता है, दर्द को भी कम करता है, आपकी मसल्स को भी रिलैक्स करता है। मोर ओवर अपने खान-पान पे ध्यान रखें। एक डॉक्टर साहब ने बताया था कि कुछ पंचकर्म प्रोसीजर हम करते हैं, वो पंचकर्म भी बहुत हेल्दी होते हैं। साथ ही में शतावरी है, शतावरी का नित्य सेवन करें। और अगर आपको रेगुलरली हर बार ये दर्द बना रहता है, तो जैसा डॉक्टर साहब ने बताया, इसमें सबसे ज़रूरी है कि आप अपने किसी भी चिकित्सक से परामर्श लें और उनकी अनुमति के अनुसार ही, उनके परामर्श के अनुसार जो वो दवाइयाँ बताएँ, वो दवाइयों का सेवन करें। ये बात हम बार-बार अपने दर्शकों को बताते हैं, बार-बार अपने चैनल पे बताते हैं कि कभी भी किसी भी मेडिसिन का सेवन, चाहे वो एलोपैथिक हो, आयुर्वेदिक हो, होम्योपैथिक हो, यूनानी हो, सिद्धा हो, कोई भी दवा हो, बिना चिकित्सक के परामर्श के कभी कोई भी दवा नहीं लेनी चाहिए। अगर चिकित्सक का परामर्श होता है तो एक विष भी अमृत के समान काम करता है, और अगर परामर्श नहीं है, आपको उस दवा का, उस औषध का ज्ञान नहीं है, तो वही दवा जो है वो आपके लिए विष तुल्य भी हो सकती है। तो कभी भी कोई भी दवाई है, उसको प्रॉपर चिकित्सक के परामर्श के अनुसार ही लें, बिना परामर्श के कोई दवाई, किसी भी दवा का सेवन ना करें। तो इसी के साथ हम आज के अपने सेशन को कंक्लूड करते हैं एंड रियली थैंक डॉक्टर पल्लवी टू बी ऑन द सेशन विद अस। डॉक्टर पल्लवी, प्लीज वी वुड लाइक योर कंक्लूसिव रिमार्क्स ऑन द सेशन। डॉक्टर पल्लवी।
Hello.
यस।
Yeah, initially, thank you, Prashant, for the opportunity. And hello, it's
Yes, Palavi, we can hear you. Please continue.
okay. So it's as I said previously, the diagnosing the disease is very much important. It's like
Right.
it's a very simple disease, but giving importance is a major thing because in the day-to-day life, it looks like a simple milder one. This milder psychological symptom after few years may be become a big issue. So it may
Right.
be disturbed to the family atmosphere or maybe the occupational area or anywhere she is maybe working, maintaining the relationship. So it is very important. Please don't take the when the female is in mood swing condition, don't think like she is faking or she is acting. Give one support or give some care what she want in that particular moment. What she is doing, it's not intentionally she is doing. The all these thing happening with her is because having some that is hormonal imbalance. That's why don't think as a joke like what she is doing at that particular junction. So care her, and talk with her, give some support and analyze. If it is not at all possible to maintain with the diets what we have prescribed or by the exercise, please consult the doctor before taking own prescription. It's very important, as the doctor said, taking own prescription that may harm the condition, harm the health. So please consult the doctor if you have any symptom. So please consult the doctor. They will advise the best treatment what it is needed. Every disease can be treated by the medication. So that's why please initial stage you can consult the doctor and take the treatment. In Ayurveda
Right.
also,
Yes, doctor, please
okay.
continue.
In Ayurveda also there are different Panchakarma procedures also explained. So by adapting all these Panchakarma procedures, we can maintain our health, we can maintain social, that is our mental health with the physical health, we can maintain, we can boost up by maybe like a rasayana treatment, or maybe rejuvenating treatment, or maybe shodhana, like you may be heard emesis, or maybe vamana virechana, like please adapt. That is some of the shodhana, rutu shodhana, some procedures are there. By applying using that rutu shodhana procedure, we can maintain our physical and mental health for a longer duration. Thank you.
राइटली सेड डॉक्टर पल्लवी कि जब भी कोई महिला को ऐसी कोई परेशानी हो रही होती है, उस समय मूड स्विंग्स हो रहे होते हैं, तो उसको बिल्कुल भी ऐसा नहीं लेना चाहिए कि वो ऐसे ही कुछ एक्ट कर रही है, ड्रामा कर रही हैं। उस समय वह बहुत सारी उनको एक ज़रूरत होती है, एक सपोर्ट की ज़रूरत होती है, एक सहारे की ज़रूरत होती है। और जैसा कि डॉक्टर पल्लवी ने बताया कि अगर वो उस समय पे ये सहारा उनको ना नहीं मिलता, तो बहुत सारे केसेस में ऐसा देखा गया है, क्योंकि रिकरेंट बार-बार वो पेन और मूड स्विंग्स की वजह से समटाइम्स फीमेल्स के अंदर ये सुसाइडल आइडिएशन भी डेवलप होना शुरू हो जाता है, और जो लिटरली बहुत हार्मफुल हो सकता है, वो इस हद तक चले जाते हैं कि वो कई बार सुसाइड अटेम्प्ट्स भी कर लेते हैं। तो ये बहुत ज़रूरी है, अगर हम आस-पास अपने किसी भी माताओं को, बहनों को, बेटियों को किसी भी ऐसे लक्षण देखते हैं, अगर हमारे को कहीं भी पता लगता है, तो बहुत ज़रूरी है कि हम उन लक्षणों को, उन अगर कोई सिम्पटम्स आ रहे हैं, उनको एड्रेस करें, उनको जाँचें, उनको परखें और उसके हिसाब से उनका उपचार भी करें। तो इसके साथ ही मैं आशा करता हूँ आप सबको आज हम कुछ अपनी तरफ से जानकारी देने में सक्षम रहे होंगे, और इसी तरह से हम बार-बार कुछ ना कुछ नए टॉपिक्स के साथ, कुछ हेल्पफुल जो सोसाइटी को, समाज को मदद कर सके, ऐसे नए-नए विषयों पे बात करने के लिए आप सभी के समक्ष बार-बार उपस्थित होते रहेंगे। आशा करता हूँ आगे भी जिस तरह आपने सहयोग बनाया, आगे बनाएगा, और ज़्यादा भी लोग हमारे साथ रहेंगे। तो इसी के साथ हम फिर अगले शनिवार उपस्थित होंगे आप सभी के साथ एक नए टॉपिक के साथ, एक नए विषय के साथ, जिसके ऊपर आगे और चर्चा करेंगे, और आप सभी को आगे ऐसे जानकारी अवेलेबल करवाते रहेंगे, जानकारी प्रोवाइड कराते रहेंगे। धन्यवाद।